So I think one of the most interesting things we actually really truly need to figure out in soft tissue sarcoma is what the mechanism of action is. We know that this is a monoclonal antibody, the platelet-derived growth factor receptor alpha. But the real question is it working in the tumor, on the inside of the tumor, or is this something that's happening in the microenvironment? And so if you begin looking at where PDGF is expressed, sometimes it's in the microenvironment, sometimes it's in the tumor. The working hypothesis is that this may alter the microenvironment in a way where the tumor actually has a hard time spreading after the treatment with olaratumab, but that treatment must be in combination with at least an anthracycline at this time. So in this patient with non-resectable disease where we're more than likely not going to be able to cure them, giving them the best overall survival is my goal. And so to treat him, we're going to use the phase 2 dosages of both doxorubicin and olaratumab. And so in the phase 2 trial, we gave 8 cycles of doxorubicin at 75 milligrams per meter squared on day 1 of a 21-day cycle. Olaratumab was given on day 1 and day 8. Growth factors were allowed and they could be given on day 2 or day 8. And so if you take that together, what we'll do is 8 cycles of that. If the patient makes it all the way through 8 cycles of combination therapy, what we do at that point is we stop the doxorubicin and we continue them on olaratumab maintenance until the time of progression. At which point we're going to put him on olaratumab maintenance, and all through this course we've used olaratumab at 15 milligrams per kilogram. So I think one of the most important things when we're bringing a new drug into a clinical practice is to understand its safety. And so going back to the original phase 1 data, I think it's important to realize that the addition of olaratumab to doxorubicin did increase the amount of mucositis, nausea, vomiting, diarrhea, but just by a little bit. In general, I mean, as a sarcoma clinician, if you went across the study statistically, it was higher. The one thing that stood out to me, especially in the Midwest, were actually anaphylactic reactions like we get to other monoclonal antibodies. I work in the Aspergillus belt, and because of that, it's important to know how to pre-medicate appropriately. But if you work on a coast, this is less of a consideration. So, having reviewed the safety, now we get to talk about the more exciting thing, which is the efficacy. If we look at the overall survival data, if we look at the combination of doxorubicin with olaratumab and compare it to the patients that got doxorubicin and then followed by olaratumab, we find an 11.8 month statistically significant overall survival for the combination. If we look at progression-free survival, it was 6.6 months for the combination versus 4.1 for just monotherapy of doxorubicin alone. This did border on statistical significance, but it was not statistically significant in the trial.